Dr. Gav.
My masturbate. Masturbate is here. Last night, we talked about system 1 of the balance method. The system 1 involves the channels in each division. Example, Tai Yin has lung and spleen. The lung and the spleen will balance each other. Xiao Yin, the same manner. Heart and kidney will balance each other, but this has to be done contralaterally, meaning the right balances the left, the top balances the bottom, and the back balances the front. This also follows the mirroring and imaging what do you call that picture? Mirroring is one side mirrors another, like the right hand mirrors the left in a sense that the wrists are the same. They have the same movement, elbows also, but then the upper extremities can also mirror the lower extremity. Like the shoulder has a hinge type of movement, so also the hip. Elbow moves the same as the knee, so also the ankle and wrist. And in using system 1, we mostly use mirroring, but we can also use imaging. Imaging is parang imagining things. Like in the picture now, you see it. That is not imaging, that is mirroring. Do you have any picture of imaging, sir?
I will check. Ay, nasa ano, wait lang po. Yeah, please continue. I'll go to the other slide.
Okay. When we use imaging like this. The hand can image the head. They are not related as the same as mirroring. What do you call this? The hand when it's clenched, yeah, that is mirroring. Also mirroring. That's still mirroring. Mirroring can be direct. Ibig sabihin ng direct, yung itaas, imi-mirror mo sa itaas. Pero pag binaliktad mo, ang isa doon, like the hand, ito sa pinakikita ngayon ni Sir, sa bandang kanan, that is a reverse mirror. And magkakaroon din ng paggagamutan yan. Like the shoulder, nung una, mirrors the hip. Pero pag binaliktad mo, now the shoulder will mirror the ankle. And so on. Like the fingers will mirror the toes. Pag binaliktad mo, the hand will mirror now the pelvis. Ang imaging, iba naman. Next, sir. This is straight imaging. You image, like in this sample, you image the head with the hand, the neck with the wrist. Itong kalahatian ng forearm, yung chest, hanggang sa ibaba. The one on the left is the direct imaging. The one on the right is the reverse imaging. You cannot go wrong if you use this. Susunod, sir. The same thing, sir. Na yung sa paa. Ayan, the same thing. Paa naman. You can image the whole body with the lower extremity. You can do a direct imaging or a reverse imaging. Parang niloloko-loko mo lang ang katawan mo. Susunod, sir. Yes, that's right. The face, whenever there is illness on the face, from the top of the head to the chin, can be imaged on the right upper extremity, not the right, the upper extremity or the left extremity. However, this can also be reversed and you would have the same result. Ano next, sir? Okay. In all of this system, there are three things that you must ask yourself. Number one, you must find out what is the sick meridian. And number two, using the system 1 or to 5, the next thing you do is ask yourself, what is the balancing meridian? And this you can only know if you know the system. Today, we're on system 2. By the way, system 1 will use contralateral needling. Ibig sabihin, kamay, ninidle mo paa, and vice versa. But this system 2, pwedeng kaliwa at kanan or kanan at kanan, kaliwa at kaliwa. However, I don't know how I can explain to you the branching channel. This involves the sinasawag nilang extraordinary relation between channels. If before, magkatapat ang Tai Yin and Yang Ming, now, ang magiging magkatapat, Tai Yin and Tai Yang, Xiao Yin and Xiao Yang, and Jue Yin and Yang Min. However, ang magiging balancing is, what do you call this? Yin Yang. Can you imagine Jue Yin beside the Yang Ming? Jue Yin has pericardium and liver. Yang Ming has large intestine and stomach. If these are in front of you, pericardium will balance the stomach and the liver will balance the large intestine. Magka-ekes. Hindi magkatapat as you will see in other system. So, the Jue Yin will balance Yang Ming, Tai Yang will balance Tai Yin, and Xiao Yin will balance Xiao Yang. Madali lang. Tai, Xiao, Xiao, Jue, Yang Ming. Are we clear on this? Because we would like to do some exercise. Using only the branching system, first thing you do is identify the same thing, the sick meridian, then choose the balancing meridian. Example, if a patient complains of lower back pain on the bladder meridian on both sides, alin po ang gagamitin yung balancing meridian using system 2? Alin po? Can you help me? Anybody? Ay, wala.
Tai Yin. Lung channel.
Yes. The balancing meridian would be the lung. Because, bakit po nagkaganon, sir? Ito na, red. Lung, red. Lung will balance the urinary bladder. Next question. Pain on the hip joint, on the gallbladder meridian on the right side. Identify first the sick meridian. Ano po sick meridian?
Gallbladder po ba?
Tama, sinabi ko. Engot ako. Pagtawa na pa ako. Okay, what is the balancing meridian?
Heart.
Wow, galing. Okay, next. Ankle pain on the right side. What is the sixth meridian?
Spleen.
Unang-una, sir, you have to ask the patient to pinpoint with your finger kung alin doon, because there are three
Spleen.
meridians.
Yeah.
Okay. It is, let us, for example, it is in the stomach meridian on the right side. How will you choose the balancing meridian? Using system 2.
Pericardium daw.
Stomach meridian, ha?
Pericardium po.
Tama, okay. If we use system 1, ang balancing meridian?
Liver.
No, system 1, sir. Sir, pardon?
Blood intestine.
Yes, you're right. In our first question, when the lower back pain, the blood meridian on both sides, using the branching channel, the UB is balanced by the lung. If we use system 1, ano po ang magbabalance sa UB?
Small intestine.
Small intestine.
Galing, that's right. Second example, hip pain on the gallbladder meridian. When we use the branching channel, it was balanced by the heart. If we use system 1, what will balance the gallbladder?
Triple warmer.
Ulit. Gallbladder? Tama.
Triple warmer, doc.
Okay, tama. Okay. The next step here would be to choose the point that we will use. And the only way we will know is, unang-una, by palpating and looking for acupoint on the treating meridian. We use as many needles as necessary, but as few as needed. So if we are not balancing or treating a point and treating an area, we may needle an area. We use 3, 4, or 5 needles, and that would solve your problem. Do we have any question regarding system 2? Malinaw na malinaw po ba? Yo. Malinaw na pa?
Siguro mas maganda if we memorize the Chinese name, no?
Yes.
Kasi I noticed like for system 2, syempre yung opposite ni Tai Yang is Tai Yin. So yung isa sa...
Right.
So
Tama po, sir.
mas maganda siguro if we memorize the Chinese name.
We always do that, hindi po ba, sir? We say Tai Yin, Xiao Yin, and Jue Yin.
Maybe we have to get used to identifying really the organ or the channel sa English.
Ako hindi ko po alam, sir, masyado sa English.
Pero I think ang importante dito is mastery of the meridian pathway, no? Diba?
Yes, you should master the meridian pathway because only then you know where to palpate.
Mm-hmm.
Can we now go into selection of points?
Yeah.
Pwede na po. Ha?
Grabe pala ito pag nag-exam, no? Ang daming question.
Hindi naman po.
Ano, system 3, using system 4. Just like this one, tingnan yun po. For the lung, you can ask like, for system 1, sino yung part?
Because in this meridian balancing, all systems can be used in balancing one organ. Pwede po.
So the first thing that you should consider is system 1.
And then up to you, sir, kung anong gusto mong go-to, what is your go-to system? You may have system 1 as your go-to system, or when we reach system 4, baka gusto nyo naman system 4 because it's just opposite. Nasa inyo po yun.
Okay.
My go-to system is 1 and 4. Usually.
Mm-hmm.
Kasi madali ko pong tandaan yung system 1 is very easy. System 4 is just opposite. Sa clock. I would like to do some exercises on selection of points. Okay po? Hello?
Okay, excited na po sila. Lalo na si Sir Mike.
Okay, we go back to system 1. Same question yesterday, pain on the liver meridian on the right side. The sick meridian is the liver on the right. And if we choose the balancing meridian, it is using system 1. Ano po? Hello?
Pericardium, Doc. Pericardium.
Right. If we use system 2, system 2 po.
LI.
LI, tama. Okay, correct. On our example of pain on the liver meridian on the right side, liver meridian on the right side. If you ask the patient to pinpoint the exact location, ang itinuro po sa inyo is liver 3. Knowing that the balancing meridian using system 1 is PC and using system 2 is LI, this is just a point, ano po? So you can balance this by just a single point. Saan po nyo tutsukin? Liver 3 po. Nandoon ang sick area. On the right side.
Using system 1?
System 1, and then we go to system 2.
Okay.
Para malaman natin. Using system 1, knowing that PC is your balancing meridian, what point will you needle? Liberty na po. Kita na.
PC3.
PC3. PC3.
PC7.
PC7.
LI3.
PC7.
PC7, LI3.
Sure ba tayo?
Hindi.
PC6.
Ano ba yan? Wala.
Di ba sinabi niyo muna, Ashi? Ano siguro yung pinakamalaki?
No, sir. May point na, sir eh. Meron ng point eh. So we can pinpoint the treating or balancing meridian and point. Okay. Let's analyze po. Let's analyze.
Okay.
Liver 3. Saan po nakalagay yun? Between the big toe and the second toe. Magkano, no? It is above. Using mirroring. Ano po naka-mirror dito sa paa? Hindi po ba kamay?
Yes, Doc.
Tama po ba? Okay, kamay. Ibabaw ng paa, ibabaw ng kamay. Knowing that PC,
Triple warmer 3.
anong gagamitin mo sa triple warmer tree? Anong ano yan? Anong
Kung sa left foot, sa right hand. Tama po ba?
tama, contralateral, yes. But is it triple warmer tree?
Just imagining na yun din yung katapat ng liver.
Sabagay, yeah, you're right there, ano? Pero our example is very specific. We're going to use PC, pericardium.
Pwede PCA.
PCH, sir? Pwede, saan ba yung PCH?
Pag sinabi mong PC7, parang nasa ankle na ang equivalent.
Tama po yun. PC7, PC7. Pero sir, ang PC7 will treat ankle area.
Yes.
Hindi po ba? Oh, PC7, liver tree po ang atin eh.
PC8.
So we should choose PC8.
PC8 po? Teka.
Or between PC8 and PC9.
Ano, PC8 yeah. PC8 would be right. PC7, PC8, right. Tama po. Pero parang, paano ugot nun? Tutusukin yung PC8. Just right. Tama po yun. A point will be balanced by a point. Using the second system, ano po ang gagamitin natin? Liver po.
Liver.
LI.
Oh, LI. Okay, what point in LI?
LI4, Doc.
Right. Ang galing mo naman, sir.
Sabi mo, wag mirror, Doc eh.
Yes, that's right. So you get the picture now. How to do it.
Yes, Doc.
Alam na. Alam na, Der. Alam na?
Medyo nakukuha na, Doc.
Okay, good. That's good.
Konti pa,
Pero,
Doc.
ano po?
Ay, sorry.
Konti sample pa, Doc.
Example.
ano?
Sige, example. Okay naman magbigay ng example.
Magtatanong ako pero hindi ko alam sagot.
Sige, sir. Susubukan namin sagutin.
Left upper tooth.
Left upper,
Oo, masakit yung ngipin niya sa upper jaw, upper tooth.
left upper.
Yeah, siguro
Okay.
yung mga teeth na yan.
Okay, opo. Sige po.
Di ba? Common yan, masakit yung ngipin.
Let's analyze. Ano po bang meridian ang nandito sa may pisngi, bandang itaas?
Pwedeng stomach.
Pwedeng stomach. Pwede ring
Small
stomach at pwede ring stomach.
intestine. SI.
SI, yeah, pwede rin. SI and stomach. So, kung yun ang ating meridian na may diferensya, anong balancing meridian ng SI at stomach?
System 1.
Well, yeah, sa system 1 muna.
LI.
LI,
SI?
system 1. LI.
Urinary bladder.
Tama, urinary bladder.
The-
Kung stomach, ano? LI. Okay. So how do we go about looking for the treating meridian endpoint? So we go to LI. Hindi po ba? Oh,
Yes.
SI, stomach, LI. Okay. Can you image the hand sa kamay, sa mukha? Image nyo nga. Meron po bang nakakatapat na LI dyan sa image?
Parang LI4.
Tama. Alright. Okay. Kung hindi gumaling sa LI4. Hindi nga, yeah. Pwede rin hindi gumaling, sir eh.
Oh, sige.
So, i-image mo naman yung stomach. Ano ba ang naggagamot na meridian sa stomach? Sabi kanina,
Liver.
LI din eh.
LI.
Stomach, hindi ba LI din using system 1?
Yes, system 1.
Oh, so ganun din. Okay, let's go to system 2. Branching. What will balance LI?
Pericardium.
Liver na.
Branching po.
Liver.
Spin.
That is Yang Ming. Yang Ming and Jueyin po magkasama nun. Liver, tama.
Liver.
Right.
Liver
Can
3?
you eat? Ha?
Di parang 4 gate.
Liver po liver po ang ang balance sa system 2 because Jueyin and Yang Ming ang magiging magkatapat. So, where's the liver? What can you do to image the face with the liver? Paa. Itaas mo yung paa mo, tapat mo sa mukha.
LI4.
Liver na po liver po.
Liver na.
Liver po. Sa tapat mo po yung mukha mo sa paa mo sa lasado.
Liver 3, Doc.
Pwede. You can try that. Ngayon, how will you know na liver 3 na nga? Pindutin mo. And if that is reactive, ibig sabihin, masakit yon, then that is the point that you're looking for. Reactive po, masakit po yung treating point. Yung po ang tutusukin nyo. Kung di po gumaling sa liver, ano pa ba ang pwedeng ipang balance sa stomach? Wala na, ano po? System 1, nakuha na natin, LI. So, nakuha na po. Hello? Basta before naka-choose na kayo ng point, pindutin nyo, and if that is painful, if it's tender, then that is the reactive point, and you should needle it there. Kuha na po ba?
Doc, for how long naman siya ini-needle?
Yun ang tanong.
Okay, how long ini-needle? Usual, ano ba retention ng needle? Usually.
Nasa 30 minutes, Doc?
Mapakatagal naman. Baka 20 lang pwede na. Okay, 20-30 minutes would be fine. 20 to 30 minutes would be fine. Pero kung tulog pasyente, bayaan mo na siya. At abutin siya ng 1 oras. Dagdag na niya yun. Example pa po, mukhang hindi pa tayo masyadong nagiging maliwanag.
Headache, Doc. GB14.
GB14. GB.
Gallbladder.
Gallbladder 14. Okay, nasaan ba yun?
Forehead.
GB14 sa itaas. Itaas ng kilay.
Yes, Doc.
Okay.
Sanjaw.
Okay, using system 1. Anong pang dito? Panggamot. Triple warmer. Okay. How will you find out the point na dapat gamitin? Image. Tapal mo yung kamay mo sa mukha.
Triple warmer 3.
Tama, correct. Ang galing mo naman, sir. Using the branching meridian, anong gagamitin mo? GB sabi mo ha, GB14.
Heart.
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 GB14?
Heart 8.
Heart.
Okay. Heart ba talaga? Heart and
System
GB?
2.
Ayan na pala. Nakatitig na sa atin. Okay. You use the same thing. You image it. Pero bago mo suksukin, tingnan mo muna if that is the reactive spot. Pindut-pindutin mo kung masakit, pasakitin mo lalo. Tusukan mo ng karayom. Example pa po.
Shoulder pain.
Ano pa?
Left
Shoulder pain. Shoulder pain.
Sa ano?
Sample lugar. Let's be specific.
SI.
TE tsaka LI po nandun. TE-LI.
Kalimutan. SI11.
SI11. Okay. SI11. SI. 9, 10, 11. Asa, wala po shoulder yung 11. Nasa scapula. Di po ba?
Lalagay ko yung paa ulit.
Hindi. Nasa scapula po yun. Di po ba?
Oh.
Yes,
Sa
Doc.
11. Ha? Saan nandun ang SA11, sir? Di ba nasa center ng scapula?
Yes, Doc.
Okay, center of the scapula. SI, ha? SI. You don't have to do any imaging. Mirror na lang.
Kasi nasa gitna.
SI. Ha? It is the center of the scapula.
So, nasa braso, Doc.
Hindi, yung ano eh. Yung, ang iba yung nasa braso. It is SI, center of the scapula. The using system 1, ang pang
Bladder.
bladder. Ang system 2,
UB.
ano gagamitin? System 2,
Spleen.
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 Okay. So, how will you find out the point using mirror and image? Mirror, sir. Ang likod. You can use the whole arm. You can use the forearm. You can use the whole leg. You can use yung thigh lang or binti. Tatapat mo. Then, you look for the Ashi point. The most reactive point is the point where you're going to stick your needle.
About bladder 57.
Pwede po. Pero ang
Ini-imagine,
hirap lang. Hirap baliktarin yung
UB 57.
putulin mo muna yung paa.
You have to use a lot of imagination pagka imaging po ginagamit. Eh pagka po naman ang gagamitin ay yung system 2, ano naman pong, saan naman pong lugar titirahin?
Spleen.
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 Okay. Kung spleen, ganun din. Paa din. Babalik-baliktarin mo yung paa mo.
Spleen.
Hanap ka
Nine
ng reactive area. How long is the needling? Pareho lang. Mga 20 minutes, 30 minutes.
30 minutes.
20, 30. Kung tulog, edi bayaan mo na siya matulog. Kahit abutin siya isang oras. The reason is like this, ginagawa ko sa pasyente, sometimes patient fall asleep. But before they do that, sinatanong ko muna, do I wake you up when the time is up or sariling gising mo ang gusto mo? Yung sasabihin ng iba, wake me up. Sasabihin ng iba, huwag mo akong gisingin. Pag nagising na lang ako, tsaka natin bunutin. Hindi po ba maganda yung ganun?
Dapat, Doc, gisingin kasi marami pang pasyenteng susunod.
Oh, well, it's up
Point.
to you. Up to you. Kasi inyo yun.
How deep the needling?
How deep?
Opo.
Ganito po. Meron pong rule in needling. Skin, treats skin flesh treats flesh, tendon treats tendon, bone treats bone. Kung ang sakit po, skin lamang, pwedeng skin deep lamang ang needling. Pagka po nasa flesh ang diferensya, up to the flesh ang needling. At kung sa tendon, up to the tendon. At kung malalim po ang sakit, up to the bone.
Wow. Thank you po. I take that note.
Skin treats skin, flesh treats flesh, tendon treats tendon, bone treats bone.
Magandang tip yan, Doc.
Hindi, magandang tip. Ganun naman talaga.
So, Doc, tatanungin mo kung gaano kalalim yung sakit.
Hindi ikaw magdidetermine nun.
Kaya nga, tatanungin sa pasyente kung mababaw lang or malalim yung...
Well, sasabihin naman sa iyo it is deep inside. Sabihin mo, there are times that I needle through joints. Pinapasok yung 1.5 inch na needle. Because ang problema niya, nandun sa loob talaga ng joint. Maliwanag na po to up to system 2. Hello?
Doc, parehas, you will ask the patient to move the area.
Yes. Also, in all those systems, to guide the chi to the sixth meridian, you have to ask the patient to move the joint or the sixth arm or what. Or, kung maganda yung pasyente, i-massage mo na lang. Tama ba yan?
Yes, Doc, pwede.
No, you have to move it or massage it. Yun ang tinatawag nilang I think dongchi ata ang tawag nila doon eh.
It's just a needle.
Po?
It's a needle.
Ay, oo nga po. Kaya kung naninigil kayo ng by the needle, lugi kayo. Meron po nagninidle na gumagamit ng 40. Hindi po ba? Kung nagbabayad-bayad needle, tubong-tubo yun. Pero pag ginamit niyo po itong meridian balance, malulugi po kayo. But however, hindi rin po. Because there are times when you have to treat an area. Ang problema po yung area, pinagpalagay na 3 inches long. Ang ininidle niyo po, 3 inches long din. You also have to treat the area. You needle the same size as the area. Ako po, kuminsan, in an area of about 2 inches, nakapag sasaksak po ako ng mga 10 needles kasi I'm chasing the pain. Kung pag needle ko, masakit pa, then I look for more AC points and nininidle ko po yun. Sana po magkaharap-harap tayo para mas madali pong matutunan at maintindihan kung talagang nakikita.
Bali, iikutan ng needle, Doc?
Ano?
Bali, maiikutan siya ng needle kung you say mga 2 inches ang...
No, you look for AC points. If lahat ng AC, so yan, ganito, I treated the patient with shoulder pain, back pain pala. Sabi niya sa akin, the back pain has been with him for about a year. Naubos na raw ang PT sa lugar nila, naubos na yung acupuncture sa kanilang lugar, naubos na rin yung mga orthodoctor, hindi pa rin maalis ang pain. Yung likod niya, 1 taon na yon. So the first time he came to me, I did balancing. Pero I was balancing an area dito sa likod. So, tinutusok ko, meron pang natitirang pain. You have to chase the pain. Sabi nga, I don't know if you have, kung narinig ko kayo na yung babae, you have to chase the pain. Ibig sabihin na chase the pain, hanggang may nararamdam na sakit yung tao and you want to treat the pain, hanap ka pa ng ibang asi at tusukan mo yon. That is chasing the pain. Kuminsan mga 1 centimeter away lang, tutusukan mo uli yun. Okay, to cut the story short, tuwing pupunta siya rito, nakakaubos siguro ako ng mga more than 10 or 12 needles sa isang area lang na about 2 inches long. So alis siya, walang naramdaman, sisiyahan naman. After several months, babalik. Meron pa rin natitirang pain, about 10% na lang natitira. So I have to needle it, I have to look for it. And it has been almost 2 years na hindi siya nagbabalik. I saw him in our TAC Congress. Sabi ko, kumusta ang likod mo? Wala na, hindi na bumalik. Well, kako, that's very good. So, naggamot nung pagbalik-balik niya rito. Siguro, lucky lang ako, kaya nagkaganon.
Golden hand.
Hindi po, swerte lang.
Golden hand.
Hindi
Ilang
po,
session yun, Doc?
nakadalawa kami.
Wow.
Ay, no, dalawa o tatlo, ata.
Wow.
Dalawa o tatlo, mga something 2 or 3.
Pero
Then I
Doc,
saw
ano
him,
diagnose mo?
I did, ang diagnosis is, ano ba yon? Stagnation of chi along the meridian.
Okay, Doc.
Nagkita nga kami sa TAC Congress, meron namang nirereklamo. Meron namang masakit ako, huwag ka na magpunta sa akin, sa iba ka na magpunta. He's from Cebu. I don't know if you've heard of him. Dr. Forte, a hemotoxicologist.
Wow.
Yung nire-refer ko kay Dr. Hector. Nagkita rin po ba kayo, Dr. Hector?
Hindi po.
Busy siya masyado. I saw him only in sa TAC Congress.
Okay.
Tapos hindi ko na siya nakita ulit.
So the balance method worked, no, for him?
Yes, it worked for him.
Kasi alam nyo, some patients are really amazed if you only use few needles and few sessions.
Yes, sir. Meron pa akong kwento, sir.
Sige po.
Merong isang araw, nagpunta sa akin, masakit ang ulo. And it is migraine on the, I think, frontal or parietal area. Meron pong needling. Ang tungs na you use only 1 needle din sa migraine, depending on the area. So I inserted 1 needle, nawala agad yung kanyang sakit ng ulo. Naisip ko, ito ba pagbabayaran ko ng full fee? Kaya isang needle lang ginamit ko. Ano pa mabuting gawin sa ganun?
Agreement.
Ha?
Agreement. Sure.
Alam niyo ng mga Pilipino, they will feel parang short change sila pagka ganun, di po ba?
Pero the mere fact na nawala yung pain, that's something.
Yeah, nawala na. Maling na siya. So what I did was, pinahiga ko pala siya, niligyan ko ng feel well points.
Saka, Doc, nagpatingin siya sa'yo, di automatic, magbabayad siya.
Yes, pero nahiya naman akong singilin siya ng full pay using only 1 needle.
No, I think that's the right thing to do.
So bagay, yeah, pero to make him feel better pa, dagdagan mo yung needles. You can put feel well points sa kanya.
Yeah,
to make him feel better. Yes. Pwede mo naman tanungin ng pasyente, if you know that you can treat him with very few needles, sabihin mo sa kanya, I can make you well with 20 needles, but I can also make you well with 5 needles. Anong gusto mo? Yung iba gusto ng marami. Hindi ko alam kung bakit. I've seen patients like that, nagbibilang, ilan na bang ginamit mong needle? 30 na. Dagdagan mo pa, dagdagan pa. Last time, 46 ang nilagay sa akin. Meron pong ganun . Hindi ko lang alam kung naka-encounter na kayo ng ganun.
Doc, pag ganyang marami ng needle, although na needle mo na yung talagang sick meridian, does it affect something na magulo na yung chi? Would that be happening? Ang gulo na ng chi, kung sino-sino nang dinaanan. Parang gano'n. Hindi ba magiging...
What do you mean? What do you mean?
Halimbawa,
Mag-example tayo.
Halimbawa, yung back pain na
Okay,
treat mo
saan
siya
lugar? Saan lugar
sa
muna?
likod. Yung katulad ng
Ay,
in-example
likod nga.
natin.
Saan lugar
Okay.
sa likod?
Sa may, sa SI.
SI. Gusto mo pala yung pinag-usapan natin sa iba naman. Mag-SI.
Sa neck.
Neck.
Pain na lang sa neck pain.
Where's the pain? Where's the neck? Dami rin ang meridian doon.
Like GB20.
GB20. Okay, so?
May pain doon.
Eh,
what I wanted to know, Doc, halimbawa na-address na yung sick meridian,
yes.
just to impress the patient na wag naman sabing konti lang yung needle tapos sinigil ako.
Yes.
Then
Ako magugulo yung chi.
Ako magugulo ba?
Ang ilalagay mo naman is feel well points lang. There are points. Di ba, minsan pupunta siya pasyente, maraming nangyayari ganito. Pupunta, what's wrong with you? Wala, gusto ko lang magpa-needle. Okay. So what will you do with persons like that?
Bibigyan ko lang ng like Tai Yang.
So no, you should have a protocol na puro feel well needles lang.
Okay.
Oo, yan ang gagawin. Meron ka bang protocol na feel well needles? Meron si Miriam Lee.
Wala pa, Doc. Kasi
he uses ganito, no? She uses, patay na to eh. She used 5 points lang to make a patient well. It is LI4, lung 7, LI11, spleen 6, and stomach 36, bilateral. So she uses only 10 needles. And that makes the patient well. They make the patient feel well. Yun ang feel well points na tawag.
Thank you, Doc.
Tanda na? Ano?
LI4, liver 3, stomach.
Ano? LI4?
Liver 3.
Uy, wala akong sinabi liver 3.
Lung 7.
Lung 7.
Lung 7.
Stomach 36.
Ano pa?
Spleen 6.
Ano pa?
LI11.
Tama. Correct.
Okay. Nakanote na po yan. Nakanote.
Sige, don't forget that.
LI11.
Kaya idol ka ni
May bilateral yun, bilateral. Okay. Question ko lang. Anong direction ang gagawin mo sa lung 7? Towards the hand ba o towards the shoulder?
Toward the shoulder.
Bakit? Kukontrahin mo?
Hindi ba para i-point ko sa kanya, Doc? Kukontrahin mo. Sa neck.
Teka muna, feel well ito. Walang naramdaman kahit ano. You just want to make it feel
okay,
well.
kung feel well. Sige, Doc, iba pala.
Yan nga pinag-usapan natin. Where will you point the needle in lung 7 in a feel well point? Dalawang direction lang yun eh. Ano ba naman?
Toward the lung.
Kukontrahin mo?
Doc.
Kukontrahin mo? Hindi mo ito tonify?
I'm not sure kasi I'm not sure.
Hindi ba yung mga feel well points, you want to make the patient feel well and you have to tonify the patient, di ba? Paano ba direction ng lung? Saan man nandun ng lung 1?
Pataas.
Saan? Sa taas.
Sa taas.
Pababa. Yun ang kanyang direction. When we tonify, ginagawa ba natin, kinokontra ba natin ang direction? Or inaayunan?
Paayon.
Yes. So where will you point lung 7?
Towards the hand.
Galing! You're good! You're very good.
Yung mga...
Ano pa gusto niyo pag-usapan natin?
Maganda yung points.
Alin pa?
Yung mga hinga-hinga. When do you...
Anong hinga-hinga, sir?
As the patient exhales or as the patient inhales? When you talk...
Hindi ko na po inaano yun. Ikaw po ang master doon eh. Sige nga, sabihan mo. Hindi ko na po natitingnan yun, yung inhalation and exhalation.
Saka, when you tonify, you insert it mo na shallowly, tapos ididiin mo pa papasok. Yun yung pagkakaalam ko. Master
Hindi
ni
ko po,
yan eh.
sino po, Sir Dino, siguro?
Yes. Yung tonification and sedation.
Sedation.
Okay, any other questions? Mukhang so I think
Doc, may tanong po.
Sige po.
Halimbawa po dun po sa fieldwell points natin, alam mo yung lang 7 nga po nilagyan.
Opo.
Then, may dati po pala siyang problem sa lungs, si tinonify. Ngayon, pag natonify po natin, minsan kasi may effect na, halimbawa, lalong uubuin para ilabas yung phlegm kasi lumakas nga yung lungs niya eh. So, need pa po nating pabalikin yun para...
Pababalikin mo po yung chi?
Hindi po yung tao kasi hindi po may effect nga po pag tinonify mo at may talagang dating problem yung lungs niya, pag lumakas, kung maraming phlegm ang hindi na ilalabas po niya yun, uubuhin talaga yun eh. May ganun po kasi ako naging pasyente. Nung natonify ko po, pero sinabihan ko siya na lalabas yung mga plema. Nung una natakot kasi lalong inubo. Pero after po nun, nawala yung mga plema, nawala yung asthma.
But this came about when we were talking about patient who does not have any complaint. Gusto lang magpa-acupuncture. Ano ba magagawa mo? Okay. So this came about, yung sabi ko, what you can do is, you can apply the fieldwell points. Lumabas nga yun. Kung sakasakaling may diferensya sa lung, then you have to treat the lung. Hindi ba? Hello po.
Yeah.
Yes, Doc.
Oo. Master din kasi ni Ma'am Mildred yung mga patterns ng lung, di ba? Lung chi.
Opo. Michael, akala ko puntahan mo ako.
Ano question po? May question. Okay.
Sige lang.
About the treatment po, isasabi na rin po ba yung fieldwell treatment?
Teka muna.
Tapusin ko muna ang treatment. Tsaka po magkakaroon ng fieldwell. Ilan po?
Alam mo, this came about na walang diferensya yung tao. You don't have to use fieldwell after treating the patient. Pero it follows kasi that after you treat the patient, he is going to feel well. Di ba? You don't have to do it as an additional needling.
Okay. Thank you po. Magkikita po tayo talaga. Very soon.
Betty. Hindi nakikinig si Betty. Vicky Brillantes, you're my friend.
Oh, yes, Doc.
Ano ba? Would you like to say anything?
I normally use my own protocol in strengthening the immunity, which I shared in the chat.
Yeah, I saw it.
Whether the patient doesn't complain of anything, especially maintenance, or say a very simple complaint which can be addressed easily. Okay. I add the immunity strengthening, especially the digestive, the stomach 25 and the REM 12. So, I get a good feedback after that.
Okay. So, suggestion mo, each should develop his own protocol.
Yeah.
Tama. You're right, Vicky. Tama.
Thank you.
Dapat. Each should have its own protocol. Yung kanilang subok na. Thank you very much, Vicky.
Okay.
Ma'am Betty. Ma'am Betty C.
Opo,
Betty, gising ka
present.
pa ba?
Oo naman.
You have any question?
Wala naman ako mako-question.
Sige, kung wala.
Okay, mukhang inaantok na si Dr. Gavino. I think it's past his bedtime.
Mag-alas na ba na? Any last word, sir?
Di ba kayo mag-last word? Okay, so I'm sure na-excite sila sa systems 1 and 2 at master na ni Sir Michael yung mga ano ba?
No, actually, those systems are very easy.
Pairings, yeah.
Ang kailangan lang po, unang-una, when we go to system 4, system 5, system 3, system 4, kailangan na po nating malaman yung talagang flow of chi at saka itong organ clock.
Okay.
Dapat po alam na natin. Pero itong cheat sheet na binigay sa atin ni Doctor, ito po napakaganda na. Pag nasa harap niyo po ito, parang ng decor, pero hindi alam ng pasyente, tinitingnan niyo kung paano gagawin.
Oo nga, no? Ang ganda.
Yes.
So, for system 2, we use the red. Red ba yan?
O nga po, red.
Red
po.
Orange. Whatever.
System po. Basta lang, basta po yung magkakakabit, yun ang pairing na dapat na gamitin.
So, in the meantime, maganda nga. Unahin muna natin yung system 1, di ba?
1. Mamili po kayo kung anong gagamitin yung go-to system.
Okay.
Go-to. Okay. Hindi po go-to ho. Hindi po ano. Go-to.
Okay. Wala na pong tanong. We can probably end this now.
Sige po, baka inaantok na rin kayo.
Hindi po.
Mukhang
inaantok. Salamat po sa mga wisdom.
Wala akong wisdom, ano? Wisdom tooth. Akin.
Okay. Pahingahin na natin.
Salamat sa time, Doc.
Okay, teka muna po before we end. Meron po nakalagay dito, if you will notice, stand a pole under the sun. Ano ba yung nakalagay dito? Immediately see the shadow.
Wow.
Ligan Jianying. Ang ibig sabihin nito, ganito kabilis ang meridian balancing. Ikaw, kung tatayo ka sa init ng araw, kita mo kaagad ang iyong anino. Ganon din kabilis itong meridian balancing. The moment you insert the needle, makikita mo na kaagad ang resulta.
Yes.
Ganon lang po ibig sabihin nun. Ligan Jianying.
Wow. What words of wisdom.
Hindi po words of wisdom.
Words of wisdom. Okay, sige na po. So maraming salamat po sa
Maraming salamat po sa inyo at sana po
Pahinga tayo bukas, wala pong Zoom.
May natutuhan kayo kahit paano.
Oo naman.
Pero palagay ko
marami Doc.
Well, you feel free to message me anytime. Ask me any question that you like. At pag hindi ko nasagot, i-refer ko kayo kay Shifu. Ganun lang po. Shifu Hector. Siyempre.
Diyos ko, nakakaya naman Shifu. Don't deserve that title.
Okay. Ano po? Sensei.
Ano dapat ang Shifu? Okay, maraming salamat po. Tomorrow wala.
Yeah, maraming salamat po sa inyo lahat. Thank you very much.
Yung mga utak natin, pati pahingayin din natin si Dr. Gavino para makapag-recharge naman. We will see you again on Thursday for Systems.
Thursday po.
Yeah. Good evening,
System
everyone.
Thank you po.
Thank you, Doc.
Magandang gabi po at salamat sa inyo lahat.
Salamat po.
Thank you, Doc.
Salamat po.
Isahan nyo nang gamitin para...
Thank you po.
Use it, try it. If you fail, try again.
Good evening.
Trying.
Magandang gabi po.
Maraming salamat po. I-off ko na. Good evening.
Sige po. Thank you po.
Bye-bye.
Bye-bye.
Bye.